host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Allison Blake from Altman Laboratory Services at the Canton campus, and Lori Leonard, Injury Prevention and Outreach Coordinator for Altman Trauma Services. Good morning, ladies, and welcome to the show.
Good morning.
Good morning.
Many people believe that blood is needed after major disasters. However, daily personal emergencies and ongoing medical needs of thousands of patients require a constant and ready blood supply. It's the blood already on the hospital shelves that saves lives. Today, there is a critical need for blood donations, and we'd like to dedicate our show to sharing information about blood donations. Every day in the U.S., patients in hospitals, surgery centers, and emergency treatment facilities need approximately 36,000 units of red blood cells, 7,000 units of platelets, and 10,000 units of plasma. When you donate blood, you're part of something bigger than yourself. It's a simple act and the ultimate pay-it-forward moment. Please enjoy our show today as we talk with Allison and Lori about the process of donating blood, the safety precautions in place, and the positive impact on donating blood has on people's lives. We'd like to remind our listeners today that our program is also available on our podcast. You can download it from the App Store in your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe.
Okay, Allison, welcome to the show. Please introduce yourself and tell our listeners a little bit about yourself and your responsibilities at Altman Laboratory Services.
Thank you, Paul. My name is Allison Blake. I'm a certified medical laboratory scientist and have been so for about 6 years now. My background is in general lab, so chemistry, hematology, all of the normal lab work that you would get done when you come into the hospital or prior to an office visit. I was our quality compliance coordinator here at Altman for about 3 years. And then after that, I was an interim manager in our core laboratory. And then for the last year, I've been the laboratory director over our Canton campus. So that's our core lab, our microbiology department, blood bank, and pathology. And I oversee operations.
Wow. So, Lori, welcome to the show. Please introduce yourself and tell our listeners a little bit about yourself and your responsibilities at Altman's Injury Prevention and Outreach Coordinator for Altman Trauma Services.
Absolutely, Paul. So good morning, everybody. My name is Lori Leonard. I've been a registered nurse for almost 37 years. In all of my experience, it's been within the critical care medicine area, emergency department area, trauma services. I've been in my current position as injury prevention and outreach coordinator for about the last 6 years. And my primary responsibility in that role is to provide education to our community to prevent injuries, but also providing education on health topics that it's going to overall improve our community's health. That also is one of my main focuses. So you may see me out in the community teaching a variety of different injury prevention strategy classes, as well as just some general topics on health education. Thanks for having us.
Very good. So we understand there's a critical need for blood across the nation. What does that mean, and how many people need some type of blood product in the U.S.?
So about every 2 seconds, someone in the United States needs a blood product or a platelet or platelets. We have such a critical need for that blood because there's a little bit of a greater demand than a supply of the blood products.
Wow. So how many products do people receive or have been transfused each week, each year? Now, you just gave some statistics, but it's kind of overwhelming that 2 seconds somebody needs blood, and they not only need blood, they need platelets and all other kinds of things. So
correct. It is a little bit overwhelming when you think about it, and a lot of people don't understand the impact that receiving a blood product does have on a variety of patients. It's just not particularly a procedure that is done for just somebody that maybe suffers an injury and has severe bleeding. Over a 12-month or 1-year period, about 16 million blood product components are transfused in the United States. That's a lot.
There was some talk years ago about synthetic blood products. Does that science advance itself or not?
That science is there. Our military has used that science for a very, very long time. It just is not something that is everyday practice in acute care facilities.
Okay.
So what type of blood products do hospitals request the most and why?
So type O negative, especially for emergency situations, O negative donors are often called universal donors because anyone can receive red blood cells from their donations. So if we don't have time to find out the patient's blood type, we can give O neg with minimal chance of a serious reaction.
Okay, so how many people in our population actually have O negative?
About 7% of our population has O negative blood type. 37% of our population has O positive blood type. So while O positive is the most common blood type, O negative is slightly below that.
Well, why O negative as opposed to O positive if you don't know the blood type?
So like I said, it has the least chance of causing a reaction in the patient who's receiving the blood. So you actually have antibodies against another blood type. If it's introduced into your system, your body's going to attack those cells that don't match with your blood type. So when you get O negative, your body isn't going to do that because you don't have antibodies against that blood.
Interesting. I guess I thought O positive was always the magic blood type that you could give it to anybody.
Well, we will give O positive to patients who are either females of a non-childbearing age or to males in emergency situations where we don't have enough O neg.
Okay, interesting.
So this is probably a question that's maybe too simple, but why is blood donation so critical to saving lives?
So blood donation is critical to saving lives because one single blood donation can save more than one life. So it's not an equal equation where one person donates a pint of blood and that the recipient can only be one more person. Because what happens is there are a lot of different components in each pint of donated whole blood. So we can take those specific components, separate them, and then they're used in specific treatments. So blood transfusions can be given to any age group, and it is known that, from any age group. So this includes our pediatric population as well as our adult population. This person, because of their illness or injury, may just need platelets. This person may need the red blood cell portion. This person may need just some plasma. And those are components that all can be taken out of one single donation of whole blood.
Okay, very good. Go ahead, Dan.
Okay. Can you explain to our listeners what red blood cells are and why are they in our body? Hello?
Sorry. So red blood cells are what gives blood its distinctive color. They are produced in our bone marrow. They carry oxygen from our lungs to the rest of our body, and they take carbon dioxide back to our lungs to be exhaled when we breathe. There are approximately 1 billion red blood cells in 2 to 3 drops of whole blood.
Interesting. So how are donated red cells used for patients who need them? Is it a liquid form or I guess I'm looking at I'm thinking about a pint of blood and you separate out all of these various parts of the blood. How are they stored, and how long do they last, and things along that line?
So are you referring to just the red blood cells?
Well, I actually kind of chased myself over to blood in general too, about how do we separate all this stuff, and how long is it good for? You know, I've donated blood over the years a couple times, and I guess I knew it one time, but I don't remember way back your ability to separate all this stuff and to utilize these products for various individuals. I guess I've got a multi-question here and probably not correct, but go ahead. Okay.
So as far as the storage of it, it totally depends upon what component of the blood it is. And Allison may be able to speak a little bit better about that. You know, it depends upon the component.
Yes, so for red blood cells, they're good for about 42 days. Platelets are only good for 3 to 5 days. And then plasma and cryo, we freeze it, and then it's good for about a year. And then we separate it all out really by centrifuging it, and then we're able to pull off the different parts.
So tell us about platelets. How important are they to recipients?
So platelets are used in situations where there's significant blood loss. A lot of times those are trauma patients, and platelets are used. They essentially help you form a clot and stop bleeding whenever you have an injury.
Okay, interesting. I guess it's time for our first break here already. You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, it is not too late to get a flu shot. Stop in any Medicine Center Pharmacy today, and no appointment is necessary. We look forward to helping you stay healthy.
All right, Allison, before the break, you talked about platelets and how they're important for recipients. Can you talk about what type of patients end up receiving platelets?
So a lot of times these are used by our trauma patients with excessive bleeding, our surgical patients that had blood loss during their procedure. They're also used for our oncology patients and for patients who are receiving an organ transplant.
Okay. Can you talk about plasma and how it's used to treat patients, please?
Sure. So plasma is the liquid portion of blood. It's that portion that contains the red cells, the white cells, and the platelets. It's mostly composed of about 92% water and 7% other stuff, such as proteins, some anti-hemophiliac factors, some salts, sugars, hormones, vitamins, different little components like that. But it's primarily water. What its function is to help us maintain good blood pressure, and it also supplies critical proteins that help to work with our blood clotting as well as our immunity. Plasma is also used to treat trauma and burn patients, patients that are suffering from severe liver disease, and patients who just have multiple clotting factor deficiencies.
All right, so one of you mentioned earlier in the program cryoprecipitate, and that's not a term that I'm familiar with. So can you talk about what that is and how it's used for treatment?
Sure. Cryoprecipitate, we call it cryo for short. It is a portion of that plasma, and it's that portion of the plasma that is super rich in clotting factors. So these clotting factors are going to help reduce blood loss by slowing down or stopping the bleeding. And that can be due, obviously, to injury, where there's a lot of blood loss, or to illness, where people are not able to produce their own clotting factors, or they do produce them, but not in the quantity that they need to prevent bleeding. We use this commonly in patients that don't clot properly, And an example of that would be like your hemophilias.
Will you please explain to our listeners what white blood cells do in our bodies?
So white blood cells are the warriors in our blood. So they essentially attack anything that's attacking you. And we have different types of white blood cells, and they attack against different things. So certain ones are very specific to a bacterial infection. Others are more geared toward a virus and things like that.
Interesting. So what are granulocytes?
So granulocytes are a specific type of white blood cell, kind of like I talked about before. And they protect against infection by surrounding and destroying invading bacteria and viruses. And a lot of times we give granulocytes to our very ill and immunocompromised patients who have a really low white blood cell count, like especially if they've been undergoing cancer treatment. So we give them these to help them fight off an infection.
Okay, so who benefits from receiving blood transfusions or infusions of the components of blood?
We can really explain that in one word: everyone.
Okay.
Really, everybody, because it's not very, receiving a blood transfusion is not selective to you having to meet an age requirement. There's not all this other prereqs or pre-requirements for it. All age groups that have a disease process or an injury that requires blood products as part of their therapy or their treatment would receive whatever component of that blood donation they would require.
One more thing. There are certain religious groups who do not permit transfusions. What do we do for these people if they need a transfusion but refuse it?
At that point, there's a lot of conversation that goes on between, the risk of receiving a transfusion, the benefit of receiving a transfusion, and if the patient is still refusing the transfusion, we need to comply with their wishes.
Wow. Okay.
How about we talk about people who can and maybe can't donate blood? So I know that there are some restrictions. Can we talk about restrictions for possibly some patients or patient types that may not be able to donate blood?
So this is not an inclusive list, but illnesses such as the cold, flu, COVID, low iron levels, recent travel outside of the United States, if you're on a certain medication, pregnancy, if you have a fear of needles or losing too much blood. So those are kind of some reasons why people aren't allowed to donate.
What about, is there like a perfect candidate that is like your go-to patient for blood donation?
I wouldn't say that there's a perfect candidate, but I know that the Red Cross, for certain blood types such as O negative, they really focus on reaching out to those donors again and again. Also, there are certain people who just make really high levels of platelets. And so those are great donors because they can come in, they can do a platelet pheresis, and they can donate platelets pretty regularly. So again, the Red Cross really follows up with those donors.
Okay. You mentioned frequently, what's a garden variety time frame that someone could donate? Is it a couple times a month, a couple times a year? What's realistic?
So for whole blood, it's every 3 months. But for platelets, it's about every 2 weeks. It's pretty frequent.
Okay. So why don't we talk about, why is there a shortage of blood? And, every year when this month comes around, I see a lot of marketing about reminders to give blood. And occasionally we'll see a blurb on TV or on the news that, like when we've had accidents, there's always a call for help, but it seems like there must always be a need. So do you ever have too much blood?
No, no, not really. This goes back to that supply and demand ratio. There are only about 3% of Americans that donate blood. So the fact that, the most needed component of blood is O negative, and that only 7% of our population are O negative blood types, and then put that into perspective that only 3% of all Americans donate blood, that's what can contribute to, us having adequate supply. One other multifactorial component that kind of wreaked a little havoc on blood donation as well is that as a result of the COVID-19 pandemic, there was obviously a lot lower donor turnout, a lot lower numbers of people that were meeting criteria to be able to donate. They wanted to donate, but maybe they didn't meet criteria because they were having an illness, as well as some of those blood drives that the community depends on ended up getting canceled.
What about individuals that okay, I come to you to donate blood and I'm taking 3 or 4 meds, blood pressure, glucose, whatever. Are these individuals suitable to donate blood?
It really depends on the specific type of medications that they're on. And that would all be kind of caught during the screening phase. But if they are on certain medications, they can't donate and they would be turned away, unfortunately.
Interesting. Okay, it's bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back. You're listening to Health Matters with Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Allison Blake and Lori Leonard from Altman Health Systems. We have a lot more to cover this morning, so let's get back to the show.
Okay, how can hospitals respond to blood shortages? What do you do?
So a few of the things that we did is we established communications with our other hospitals in the region so that everyone knew what the inventory was like at each hospital in case somebody needed to ask for help. And there were hospitals that did while we were in shortages. We were very lucky that we never had to reach out to somebody else, but we also took daily inventories of what we had on hand, and we reported that out to leadership in our hospital so that if we needed to change operations, possibly send our traumas to a different hospital or look at doing a surgery on a different day, that we could do that. We secured a secondary blood product supplier. So we normally get everything from the Red Cross, and we actually initiated a secondary contract with another supplier. And then we also had our medical director review all of our transfusions to ensure that the patient did need the blood every time that they received it.
So I think the most important thing we probably ought to talk about that we haven't this morning yet is where can listeners donate blood?
So Altman is partnered with the American Red Cross and also Community Blood Center, which is actually out of Dayton, Ohio. And then Vitalant is another major blood product supplier in the area. And then Altman Canton actually has 3 blood drives scheduled for this year. We have one on May 30th, one on July 13th, and one on September 13th. Altman Orville and Altman Alliance also have several blood drives scheduled for this year, and those can be found online.
Interesting. So how do we find a drive? Go on your website. Red Cross have them. Multiple other places have them. And I do remember at the university that my daughter went to that there was a company there that was collecting either just plasma. Would that be correct?
Yeah, there's a lot of companies that just collect plasma.
Why, why not the whole gamut?
Plasma can be used for other things outside of just giving it to patients. So in the lab, we actually use it for some of the reagents and controls and stuff like that we do with our testing. So some of the plasma collected at those places, it doesn't always go to a patient.
I see. Interesting. So, okay. What about the donation process and how much time should one allow to donate?
So I'll answer the first, and then I'll let Lori answer the second. So you can go online to www.redcross.org/giveblood, and also to givingblood.org/donateblood. You can download the American Red Cross app. Also, there are a lot of places that will advertise for their blood drive. So churches, schools, community centers, universities, hospitals, all will post blood drives. And then you can watch social media, newsletters, and advertisements.
Is it painful? Okay, you got to answer it.
Well, you have to put pain in perspective. It does involve a needle. So, we all are on that spectrum of whether we have that fear of the needles or not. But, the staff is really, really good with, talking through with some people and things like that. So, to donate really is not going to take hours and hours and hours. If you're going to do a whole blood donation, there's kind of a process, if you will. So you'll register to donate, then you'll complete your health history. The people running the donation center will go through, whether you meet criteria, don't meet criteria, things of that nature. Actually, to donate whole blood really takes like 10 to 15 minutes. And then there's like a little refreshment recovery phase afterwards, which it can be anywhere from 15 to 30 minutes, just to make sure that you feel okay, you're good, and you get a little refreshments at the end just to help you out.
I believe from my college days that we have 6 to 8 pints of blood in our system. Is that correct? The average person?
Like 4 to 5 liters is your total volume, your total circulating volume.
Okay.
So, taking a pint, yes, does lower your blood volume, but it doesn't lower it to the specific level that would cause you a lot of issues.
How long does it take to the normal individual to replace that blood that they've donated?
That's why we have that 56 days between donations of blood products. It's to give your body enough time to replace what you donated.
Okay. And does the most blood come from these donation benefit, whatever days that you just spoke about? Or does it, okay, so let's say I'm having surgery, okay, and I need blood. Does it normally come from the family or not?
It's very, very rare for us to receive a directed donation, that's what that would be, is if you come in and you say, I don't want to receive blood from just anybody. I want to receive it from my aunt. Okay. And then they go and they donate blood specifically for you. That's very, very rare. And then there's also the other half of that is if you don't want to receive blood from anybody but yourself, we can do an autologous donation, which is where you give blood for yourself and then we have it on hand for when you have surgery in case you would need it.
Okay, repeat please one more time the length between donations.
It is 56 days for red blood cells.
Okay. So, okay, we donate blood. What happens to the blood after donation?
So, like I said earlier, we separate it out into the different components, which we do by centrifuging it. And then we also test the donation to make sure that it's going to be safe for the recipient. So we look for things like HIV, STIs, parasites, hepatitis, and then we package the blood for storage and shipping.
Okay, so what I just got from that was you separate every blood donation?
The Red Cross keeps a small supply of whole blood on hand, but it's not used very often.
That's interesting. I guess I often thought when you got a blood transfusion, you got a blood transfusion. It was the whole blood.
No, most of the time you're getting packed red blood cells.
Interesting. So how do you know the blood is safe from recipient?
So each donor is screened for the risk of transmissible diseases. That's why we ask you all the things that we do prior to you donating. And then each unit of donated blood in the United States is routinely screened against various infectious diseases. And they actually, the Red Cross will kind of change what they're testing for if they see like a prevalence of a certain disease. So for example, when Zika became more of a thing, they started testing for Zika in their blood products.
Gosh, I can't. What about someone who's an alcoholic? Can you take his blood? Her blood? His blood?
That's a very good question. I don't know if they screen for levels of alcohol in someone's blood.
Why I bring this up is I'm thinking about, okay, you get stopped for drunk driving, and if you don't test, you're in trouble.
I believe that they would, because they would be screening for other drugs, and alcohol is a drug, and you should be able to pick it up.
And I keep hearing these blood percentages of that alcoholic, that you're guilty of driving while intoxicated. Do you happen to know those? I mean,
not off the top of my head, but yeah, I believe it is one of the things they would screen for, and you would catch it in a normal drug screen.
Okay, so would that be the real? That's probably one of the real. How do I put this? We don't want your blood, okay? With someone who tests positive for.
Yes, they're not going to look for a certain level. They're just going to
for legal alcohol limits. Okay, all right. Okay, I just think it is so scary. People coming in with all kinds of drugs, and let's face it, we have a druggy society. And do you test for marijuana? Do you test for narcotics? All that sort of thing.
Yes, all of that is screened for a blood product, and then they're also going to look at prescription medicine too. So It's not just your drugs of abuse.
Okay. All right. Go ahead, Brad.
So in the spirit, of talking about safety, what can you touch on just some risks that may be prevalent for getting a blood transfusion for the patient side, receiver side?
Yeah, so one of the biggest risks that people take, and this is really a risk that you take when you put anything in your body, so it does not delete blood products, it includes them, would be you having an allergic reaction to a component or something that's in that blood product that you're receiving. That's always a risk. Everybody in the community usually, is more worried about, am I gonna pick up a transmissible disease and, all of this stuff because it's blood. But really on the receiving end of it, anytime you receive a medication or a blood product, you are at risk of having some type of an allergic reaction, whether that be a mild reaction or whether it be something more severe that interferes with your breathing and such. So when we give blood products to patients, they are monitored continuously. And the reason they're monitored continuously is because if they were to have a reaction, it's more prudent to pick up on that as soon as you note that change in their status, than to just, give them a blood product and hang it for a couple hours and come back and check on them. That's really not best practice. So we do monitor them continuously as they receive their blood products. And then obviously we have processes in place if somebody should have a reaction.
Wow. Ladies, our final break is here. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. This is our final segment of the show. Quick question. Was blood collection slowed dramatically during the last year or so, or with all the corona problems?
Yes, I believe that it was. I do not have specific numbers on that. But, there were, when we had all the quarantine at different levels going on based on where we were in the pandemic, We had a lot of people that were ill. We had a lot of cancellations of events, and unfortunately, blood drives was one of those events that continually got canceled.
I guess it was so much isolation of so many people, everybody wearing a mask and all that kind of stuff. I was kind of thinking that, gee whiz, it would have been very difficult to hold all these. And are you back to full collection services now?
Go ahead, Allison.
We're back to hosting as many blood drives as we did in the past. I know that the Red Cross still experiences staffing shortages and things like that, or as a result of the pandemic, similar to other areas of healthcare. And then that does sometimes result in the cancellation of pre-scheduled blood drives.
Okay.
So earlier in the program, we talked about how long blood can be stored, and it certainly isn't that long. But, if you can't donate blood because maybe you take a certain medication or you have a health condition, how can you help? Is there still something that people can do to help contribute to the cause?
Absolutely. And, I really think the best thing, the easiest thing to do is to have conversation, to encourage your friends, encourage your family to donate. We live in a society now where we take a lot of things for granted sometimes. And sometimes we're not really impacted as to how important one donation of blood can be until it hits us personally or within our immediate friend group, family group, support system, and somebody gets really ill and we see the benefit that they get from receiving blood products. I think that, it would be great if we could not be so reactive, if we could be more proactive in like, hey, this is really saving lives and I can donate one time and they're going to be able to help out multiple recipients, not just one person. So I think that conversation and just encouraging friends and family to donate is really a huge component to people just kind of really giving some thought to it and doing their own little research and looking at what's available to them. Where's the closest drive? When is it? What do I have to do to participate? Another great way would be to volunteer to help with any of those local blood drives. That would always be received. We also live in that world of technology. So, if you are not able to donate or participate in a blood drive, but maybe you see that advertised on your social media somewhere, please share it because, everybody has generally a really large group of followers on their social media accounts. And, what a better way to reach people than to share that type of information.
All right. All good tips. Now, earlier in the program, also, you mentioned you have some blood drives planned coming up. Could you touch on those again for listeners just joining on us?
Yes. So we have 3 scheduled this year. One is May 30th. The other is July 13th. And the last one is September 13th. You can register for those online. And we do hold those on campus in our Morrow house.
Interesting. I remember some years ago a very famous baseball player, and he was from Central America or something in that area, and his wife was from another culture completely. They had a daughter, and the daughter developed leukemia, and there was no blood type that they could use for this girl. She was a young woman. Is there a solution now for something like this, an individual like this with blood donation?
So beyond just your blood type, so beyond being O neg or O pos or AB or any of the normal blood types, there are additional antigens that you can have and be positive for. There's a very long list. It's more common for our oncology patients, even our young ones, to develop antibodies against these certain antigens. It's just because of the frequency that they're getting transfusions, and the more that they're getting exposed to different antigens present in other people's blood. So what we do in those cases is we do a little bit of phenotyping, and we look at the genetics of the person that is going to be receiving the blood. And then we can go across the country really and find a person who is going to be a match for them. But these things have to be very, very pre-planned.
Interesting. Okay. I live in Canton, Ohio. Okay. And I need a rare blood. Okay. It's California. It's the only blood. How quick can you find that?
So a Red Cross would take care of that. It could take us a little while to get it shipped here, but we could probably get it here in a couple days.
Could you, if this was an emergency, what would we do? Could you give me plasma, or?
If it was an emergency, we would give you a unit that's going to cause the least amount of reaction, okay, and then we would deal with the reaction.
I see. Huh. That's really amazing. So you'd get in here a day or two? Okay. We've had numerous cardiologists on our radio program. We've been on the air for almost 13 years now with this program. And many, many new techniques have been developed in cardiology surgery and things like that. Is every open heart bypass surgery, does every one of them require blood transfusions?
No, not all of them require blood transfusions. There are certain surgeries where it's more likely than others, but for all surgeries, we do have a certain amount of blood products on hand for those patients, okay, with the hope that they won't need them.
I see. Interesting. I know, because I remember years ago that there was, in the early days of open heart surgery, there was a lot of blood used. And I guess not so much now. That's really interesting.
And Paul, you touched on a really great fact. You know, technology has really brought us a long way. So, you know, somebody that may have had an open heart surgery in the 70s or the 80s and is having one now in this decade, even though it's the same surgery, trying to get the same goal and the same outcome, things are done a little bit different. That's the miracle of science and technology. It is really pushing us forward.
Well, you know, Brad and I have learned a lot during these programs from all sorts of folks, including yourselves. And the advances in the time that I've been a pharmacist have been absolutely amazing. And robotics and all that sort of thing to be used in surgery. So the blood program today is very interesting, and we appreciate that coming on. And
yeah, we're getting close. We probably ought to make sure we share your contact information with our listeners, who are all going to be inspired to go look for their nearest donation center and make a donation next week, right?
We hope so.
Interesting.
So if listeners want to get in touch with Altman about blood donation, what's the best resource for them to reach out to?
So they can reach out to me at Allison, ALLYSON.Blake, BLAKE @altman.com.
Excellent.
Okay. Any other information you'd like to share?
Just remember that one donation can save many, many lives.
Yeah,
you know, we never sign up to have an accident or an unexpected injury that's going to cause blood loss, as well as, you know, a new diagnosis of a disease that's going to require us along our treatment journey to receive some type of blood product. So I would encourage everybody to at least consider it, and you know, go check it out. You know, we do understand that it's not for everybody. We do understand there are a lot of people that would easily meet that eligibility criteria to donate. You know, just think about your support system, your friends and your family and your loved ones. We certainly don't ever want to get into a situation where in order for somebody to survive, they need blood product and we can't get it.
Interesting. Well, I guess we're out of time, right, Brad?
Yeah, we're out.
Okay.
Thanks, ladies.
Yes, thanks very much today for coming on, Allison, from Altman Laboratory Services and the Canton campus, and Lori Leonard, Injury Prevention and Outreach Coordinator for Altman Trauma Services. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health System, Studio Arts and Glass, January Appraisals, and Liquidations, who are having a tag sale this weekend. As always, we thank your listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. And we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, ladies.
Thank you.
Very interesting.
Thank you.
Program is
Have a
sponsored
good day.
by the Medicine Center Pharmacy.
You too.
Coming up today at 3 on the Kenny and JT Show. Excited to talk.